An estimated 100 million Americans suffer from chronic pain. That's more than diabetes, heart disease, and cancer combined. Some patients take prescription drugs, but they might worry about overuse. There's a new FDA-cleared alternative. Dr. Natalie Strand is here to tell us about it this morning. Hi, Natalie.
Hi, Mary. Thank you for having me.
It's good to see you again. What are some examples of chronic pain conditions? I think it may be important to start there.
Absolutely. Some of the more common ones, things like sciatica, fibromyalgia, osteoarthritis, and diabetic peripheral neuropathy. Those are really common examples of chronic pain syndromes.
What is it like to live in chronic pain, and how do some of your patients describe it to you?
It's so difficult to live with chronic pain. I mean, certainly there's a wide variety. Some people are a little stiff and it keeps them from their favorite activities. Other people really can't get out of bed. But it's something that can affect your relationships. It can affect your ability to go to work. It can affect your ability to travel or play with your grandkids. So it really can affect a lot of people's lives, and people describe being very uncomfortable or not being able to sleep or having a pins and needles sensation or changing their shoes 5 different times to try and find comfort. So it affects everybody differently, but it can be very intense.
How do you treat it?
I personally treat all of my patients with a very tailored approach. I think it has to be a multimodal therapy. Certainly medications are appropriate at times. Exercise is important, a good diet. But I also think it's very important to stay up on new technologies like the Quell device that uses a non-opiate mechanism for pain management.
And that's what I was talking about as we were leading into this conversation. This is FDA cleared, right? And patients could wear it 24/7.
Absolutely.
How does it work?
It works, it's a very sleek wearable device that you wear on your calf, and it works by stimulating a peripheral nerve and sending signals to your brain to actually release more of those opiates that your body naturally makes. So it turns down the volume of pain and actually leads your body to perceive less pain.
And I see in the video here the gentleman using his smartphone. So is there an app that ties in?
Absolutely. So for people who are technologically savvy, I really like this part. There's an app that lets you track your pain, track your quality of sleep, so you can see over time how much you're improving. And I think that's really encouraging for patients that live with pain.
Okay, so that's if you're technologically savvy. Some people are not. Can they still use this device?
And even if you're not, this is still really easy to use. So don't let that intimidate you. It's very simple to use. It's simple to calibrate. And then once you put it on, you can let it go, and it really requires very little attention. So it's easy to use, but if you want to take advantage of the technology, it's there.
What are the benefits of this compared to, let's say, some of the prescription drugs where, in fact, a lot of patients do worry about addiction?
Absolutely. Well, you know, prescription drugs not only have the potential for addiction or dependence, but sometimes they have some pretty difficult side effects like nausea or constipation. Certainly, you know, the cost, and while medications are certainly appropriate at times, if you can use something that doesn't have those side effects like the Quell device, I think that's very appealing to many patients. And also it is over the counter, so you don't need a prescription to obtain it. You can go to quellrelief.com and purchase a unit and try it for yourself. There is a 60-day money-back guarantee. So I think for my patients, it's a low risk and potentially high reward treatment, which is very attractive.
Would you still encourage our viewers, even though they can't get it over the counter, to talk to their doctor about their plan and what they're adding to it?
Absolutely. I think you should always work with your physician, because if you're going to be getting off of medications or changing medications, you certainly want to do that with your physician's full knowledge and support. I don't advocate people making those changes by themselves.
Dr. Strand, thanks for joining us today. We appreciate your time.